This agreement, I believe, is a good deal for our residents. It continues the long-standing commitment of accountability, transparency, and partnership between the city and Denver Health to benefit all of our residents. And it takes new steps to ensure that anyone in need of these services, no matter where they are, when they call for help, they will continue to receive the best possible medical care that we can provide them and save lives. Because that's the most important thing.
I like to emphasize the fact that Denver Health is accountable to the city. It's also accountable to our citizens, and that we believe that as we move forward, enhanced transparency around what we do and how we collectively respond to emergencies in particular is going to be important. We have a goal to continue to improve response times, no matter who is responding, and to make sure that the distribution of this response team meets the needs of our citizens. So under this new agreement, there will be a second medical director added to the emergency medical response system. So 2 medical directors, one at Denver Health and one at the fire department. And in the spirit of collaboration, we will jointly select those medical directors. Our fire department personnel who now get trained in BLS and ALS will see enhanced training to support that. However, our Denver Health paramedics will continue to be the lead paramedics at the scene. And in addition, we made clear that the transport of patients is a responsibility, the sole responsibility of Denver Health.
Denver Health and the paramedics may be, like a lot of other agencies and services, stretched with staff and resources covering a growing city. We're growing massively out there, but they are very committed. What our fire department, and what I want the people to know, is the fire department of the city and county of Denver said we are partners with the paramedics. We want to help as best we can while we're on the scene. Oftentimes we're first to arrive. Give us the ability to help people instead of standing around waiting. And I think this new agreement that we have, where there are 2 medical directors, where our fire department members are trained to provide not only basic but advanced life support while on the scene under the direction of a medical director, will make a difference. And then when the paramedics arrive, they become the lead on the ground.
One of the things that we're observing is that we often have to hire people into jobs at actually a higher salary than somebody that's got experience, and that's not right. So our desire is to keep people, continue to see them be paid a living wage, and to be able to also train them and get them to move up the ladder. Any employee who leaves breaks my heart, because we've invested time training them and getting them part of the team.
And we don't have as much of an issue attracting people, but we need to do a better job of making sure that we keep the people that we have. That is our most valuable resource, and making sure that they feel valued and appreciated. Obviously, as we continue to grow and approach things differently, we will have to take a step back to look at the parameters of the types of people that we're hiring and what certifications they have currently in place.
As we summarize this is let's say a $70 million agreement between Denver Health and the city of Denver. There are, as Donna pointed out, 35 different sections in this agreement that you should look at, because this is just one of the areas that we work to make an improvement. There are greater delineations in terms of roles and responsibilities under public health, as well as more coordination, stricter coordination with services in our jails, with the Sheriff's Department and Denver Health. And again, trying to tighten up and to improve those operations. We went into this wanting to improve services to the people of Denver, whether they are being met on the street, or we're dealing with them in detention facilities, or how we further coordinate around public health.
I'm excited for what we're going to be doing for our city going forward. I'm excited for the partnerships. I'm excited for how our citizens will be identified in a different way. The people of Denver will be identified so that we can isolate those areas and make sure that everybody is getting equal response coverage.
This is important. It's important. It's something I've worked on since I was a city council member. You acknowledged that. And I'm glad we've arrived at this moment, because I think it's a partnership that ultimately will benefit the people of Denver.